It was 1 year ago this month that one of television's most beloved actors died. Matthew Perry gained international fame starring as Chandler Bing on the long-running sitcom Friends. Perry, though, suffered from severe addictions to drugs and alcohol for most of his life. And last October 28th, the 54-year-old actor was found dead in his backyard jacuzzi at his home in California. Since then, 5 people have been charged in connection with helping him acquire lethal doses of the drug ketamine. And we're going to talk more about what that drug is exactly and why it's dangerous with my guest today, Adam Winstock. Adam, welcome. You're a psychiatrist and an addiction medicine specialist. First of all, just set the stage for us. What is ketamine exactly?
So ketamine is something that's widely used in medicine as an anesthetic and as a painkiller. It's often used with children, but also in battle zones. But increasingly, it's now recognized as a medicine or a drug that can be used to help people with depression. And people have used it recreationally for over 20 or 30 years.
So it obviously has good uses. It's used for therapeutic purposes, like you were just mentioning. So why is it so dangerous?
I think that lots of things that have potential medical effects can also be used harmfully. People use it recreationally because a little dose can make you feel fluffy, maybe a little bit drunk, but bigger doses can give people very intense experiences, hallucinations. But the reason it can be particularly risky is at higher doses, it can render you immobile, paralyzed. You can't talk, you can't move. And that's why one of the things that we always say to people is that you never take this when you're playing with knives or driving or in bodies of water, because you can drown and you won't be able to help yourself. And of course, if you're rendered immobile, you might be vulnerable to sexual assault, for example. Longer term, there's also risks, particularly if you mix it with alcohol, that it can damage your bladder very, very severely.
So as far as we know, is that what ended up killing Matthew Perry? He was rendered immobile in his jacuzzi and drowned?
I think there were a number of substances involved, including opiates. And like most drugs, if you mix ketamine with other substances, you increase the risk. So I would imagine it would probably be a combination of the chronic effects of the many substances he had used over the years, plus the combination of ketamine and other substances. But certainly taking ketamine and being rendered immobile, it would be so easy to drown and not be able to call out for help. And the fact he was unsupervised during that really is I think it was entirely preventable, aside from the irresponsible provision of substances by people who are doctors.
Indeed. And a doctor who has already been charged in the death of Matthew Perry has already pleaded guilty to a charge of conspiring to distribute the surgical anesthetic, ketamine. Now, in his plea agreement, that doctor admitted to obtaining ketamine from both his former clinic and a wholesale distributor through a fraudulent prescription. Do we know how common that kind of practice is around the world?
I think much more frequently people are getting legitimate prescriptions from doctors who are perhaps prescribing without due diligence. And we obviously saw that in America for decades, prescribing prescription opioids. And I'm sure there are dodgy doctors who write dodgy prescriptions, but by far and away, the biggest issue is actually people misusing prescriptions that doctors have given them and doctors not being careful enough about who they're prescribing to, why they're prescribing, and the supervision.
And we know that ketamine is becoming more of a problem, for example, in the United Kingdom, where you are. Recent data has shown that the number of people seeking treatment for ketamine addiction has actually doubled from 2019 to 2023. What can someone do if they think they have a problem with ketamine addiction?
I think it's to come forward and try and get help. Ketamine is a drug of dependence, but far fewer people develop dependence on it than other substances. And very often it's not in isolation of other things. So there may well be trauma or depression. And my worry is people are increasingly seeing evidence that says this may be used to treat depression, is that people may be trying to treat themselves. But treating yourself with LSD, ketamine, psilocybin outside a clinical environment where there is support and assessment is hugely risky. If you can't control your use, you're using more than you want to, you're finding that you've got pain when you pee, you have blood in your urine, you can't function without it. They would be the sorts of things that would make me want to seek help, but not just for your substance use, but also for the other things that might be going on in your life.
Absolutely. Adam, thanks so much for sharing your expertise with us. Adam Winstock, they're a psychiatrist and addiction medicine specialist. Thank you.
Thank you.